been a pleasure to work with all my fellow freshman senators here on the floor again and to join them right now. Last fall, we gathered regularly in this chamber to fight for health care reform. As a group, we helped lead the charge to make quality, affordable health care accessible to all Americans. Yesterday, the change we've been fighting for became a reality. With President Obama's signature, health care reform is now the law of the land. This moment has been a long time coming. Teddy Roosevelt first called for health care reform nearly a century ago. His banner was taken up by a long and distinguished list of men and women who advocated for change. For too many years, New Mexicans, like Americans across the country, have struggled to find or afford health insurance. They've struggled to hang on to policies that get more and more expensive and more restrictive every day. With this reform, all of that begins to change. No longer will insurance companies be able to discriminate based on pre-existing conditions. No longer will they be able to dramatically increase rates without public scrutiny. No longer will 32 million Americans worry every day about what would happen to their families if they get sick or are in an accident. I'm proud to have fought for and voted in favor of this historic legislation. Yesterday, we began taking back control of our own health care. Today, the journey continues, and I pledge to continue fighting every day to ensure New Mexico families and small businesses have the security and stability that comes with access to quality, affordable health care. The reason I've fought so hard for reform is simple. For my constituents, the status quo is not an option. So it's the people of New Mexico I'd like to talk about today. They are the reason I stand up every day and fight for comprehensive reform. People like Catherine Whitesides. Catherine lives in Clayton, New Mexico. We met last year when she attended one of my healthcare town halls. Catherine worked hard all her life. She had affordable insurance through her employer. But since she retired, Catherine's health insurance premiums have risen dramatically, from $110 a month when she was working to more than $800 a month today. Catherine's insurer recently denied a claim for a treatment she received. Now, on the top of skyrocketing monthly premiums, she also owes about $4,000 in medical bills. That's more money than she receives from 5 months of pension payments. As Catherine herself said, "It's unsustainable for me, and I know I'm not the only one. I'm just looking for some relief, not just for me, but for all those people coming behind me." To folks like Catherine, I say relief is coming. This reform will make health insurance more affordable by placing caps on out-of-pocket medical expenses. It would make it more affordable by providing premium assistance through tax credits for low and moderate income families. I'm fighting for New Mexicans like Catherine, and I'm also fighting for New Mexico small business and for entrepreneurs like Arvin Reichor. Arvin has owned a small business in Albuquerque for more than a decade. As the boss, he made it a priority to provide his employees with good benefits. For years, he paid 100% of his employees' health care premiums, but he's not sure how much longer he'll be able to do that and stay afloat. You see, for the past few years, Arvin's insurer has increased his company's health care premiums by between 30% and 40% every year, and there's nothing Arvin can do about it. As Arvin said, we've got no bargaining power. We've got no leverage. I'm insuring maybe a dozen people at my company here. It's very hard. The insurance companies give you a 30 or 40% increase, and that's what you get. It's too big a bite. To small business owners like Arvin and their employees, I say relief is coming. This reform will help small businesses by making it more affordable for them to offer coverage for their employees. We do this by providing tax credits for up to 50% of premiums and by creating small business health exchanges to build a larger employee pool. In New Mexico, the vast majority of our insured are employed, but they and their employers can't afford coverage. These new tax credits will help our small businesses provide insurance for their employees at a cost that they can afford.